Insomnia and sleep problems are a big issue for our modern life. Some estimates put the number of adults with symptoms of insomnia as high as 33 to 50%, so it's not exactly rare. For patients undergoing treatment for cancer, though, the rates of insomnia can be as high as 50%. It's understandable. There are many reasons why someone undergoing treatment might have problems sleeping, from stress and long hospital stays to side effects from medications. After a bad night of sleep, fatigue can set in the next day, making people feel sluggish while they're awake. You don't need to be told this is a problem. You're probably experiencing it. There's a lot of science that tells us getting good sleep can impact our health and well-being, both physically and mentally. While our bodies regularly undergo repair, they are most effective at trying to fix themselves when we're asleep. This includes functions important for your recovery, like the immune and circulatory systems. Some of the strategies presented here might seem obvious, or maybe you've already tried a few. Consider this video a buffet. You might not like all the offerings, but maybe you'll be reminded of something that works, or you'll discover a new habit you love. There are many things that determine your sleep patterns, and some of them are outside your control. However, there are some factors that you can control. In fact, when you actively create and stick to a daily schedule, participate in your healthcare, and make healthy lifestyle changes, it can give you a sense of control. This may have a positive impact on your mental health and lower bouts of anger and frustration. Let's take a moment to look at some science. Melatonin is a hormone that our bodies create to help regulate sleep patterns. It may also be involved in different anti-cancer mechanisms. But when we're stressed, our bodies produce hormones like cortisol that can affect melatonin levels and prevent sleep signals from reaching your brain, potentially making sleep problems worse. One way that may help decrease cortisol levels and improve sleep is through exercise. Physical activity not only helps you sleep, but has been associated with lower levels of fatigue in some patients with cancer. Try not to exercise within 2 hours of bedtime, though. And of course, listen to your body and speak with your doctor to discuss what level of physical activity would be right for you. Our natural sleep patterns are related to day-night cycles, and our bodies can become confused by lights from devices that are too bright. As you approach bedtime, avoid bright lights and screens like TVs, computers, or phones. Help regulate your internal clock by limiting these at least a few hours before bedtime. Speaking of bedtime, following a regular schedule for going to bed and waking up, even on the weekends, can help regulate your internal clock. Remember how gaining a sense of control can help lower frustration? Creating a relaxing bedtime routine is something within your realm of control and sends signals to your body that it's time to tuck in. Another habit that can improve your sleep is avoiding caffeine, such as chocolate, soda, some types of tea, or coffee, especially later in the day. Consuming caffeine with sleep problems can create a cycle and make the sleep problems worse. If you're fatigued during the day, drinking caffeine might give you a jolt to help you feel more awake. But if you drink too much or too late, it will stay in your system, contributing to sleep problems and making you feel fatigued the next day, and the cycle will repeat. In fact, several choices you make around food and drink can impact sleep. It's best to limit both alcohol consumption and large meals before bedtime. Plus, limiting fluids in general before bedtime can lead to fewer disturbances during the night. But be sure to follow your care team's guidance on your fluid intake. Sleep problems can have several causes, and solving them might take time. Start by speaking with your healthcare team if you're experiencing fatigue, trouble sleeping, or any adverse effects from your medicines. They may be able to help. Otherwise, don't put too much pressure on yourself and start with just one thing. Maybe limit caffeine and alcohol. Set healthy schedules, including a bedtime routine. Find time to exercise, or avoid bright lights and screens at night. Then, build one habit, one change on top of another. Slowly, by repeating these strategies, you'll get some control back, and chances are, you'll get better sleep too.